Part 3, G for genetic screening. It is optional for genetic screening. It is not mandatory, but this is something worth considering if you're over the age of 35, you have any known chromosomal abnormalities for yourself or anybody in your family, or if you have concerns and your insurance will cover it. Genetic screening is always an option, so ask your provider which ones that you can qualify for. H is hospital. Get familiar with the hospital, the route to the hospital, how to get a hold of somebody if you need them, getting your home ready, getting a nursery set up, and hand washing is very important because germs and bacteria are everywhere, but when you're pregnant, some are very sick for baby. Heartburn is very common. That's one of those common discomforts during pregnancy. Your hair can get thinner. Don't worry, it's all the hormones that are going to be changing throughout your pregnancy. That's H. I is insurance. So if you have insurance, this should cover your pregnancy in a global package. Depends on where you live. This is something that's you're eligible for. And iron is very important. So typically once you get to about 24-28 weeks, we'll repeat a CBC because this is when you're most hemodiluted and your blood vessels get really big and you can become anemic. So we might need you to take iron if that's the case. Iron can make you constipated, so be aware. That's why it's important that we get good nutritional choices throughout our pregnancy so we can keep our iron high with food choices. J, this is a joint effort. It takes two people mainly to get into the pregnancy or the situation the majority of the time. So joint support systems, join a peer support or group. There's a lot, join some classes that you can learn about this. J. K, know your limits. So when you are achy and crampy, those are signs that you're probably doing a little bit too much and you might want to slow down. If you have strong cramps, if you have a massive weight loss or weight gain, we need to discuss that. Headaches, dizziness, chest pain, short of breath, those things we'll want to talk about throughout pregnancy. Bright red vaginal bleeding, we need to see you as well too. So there's lots of common discomforts. There's also things that are worrisome that we want to know about. So just know your limits when you're doing too much. L, learn about the practice, learn about your food choices, learn about your baby growing inside of you, what's changing about you, but also the growth of the baby. Legal drugs, such as alcohol, caffeine, minimize them, know about them. You should also limit your caffeine, read your labels. That's very important, read your labels. Running out of time, part 4 coming up.